Everyone knows that drilling is an operation of making a hole by removing a volume of substances from a hard body substance using a cutting tool called drill or bar. But here, it's not what you think. Now we are discussing the drill and its machine used in medical science to save our heart. As everyone knows that our heart is a vital organ and it pumps blood to all parts of our body. The blood pumped by the heart provides our body with the oxygen and nutrients it needs to function. Like all other tissues in the body, the heart muscle also needs oxygen-rich blood for its function. The coronary arteries supplies these blood to the heart muscle. Coronary artery disease, in short known as CAD, is the term that describes what happens when your heart's blood supply is blocked or interrupted by a buildup of fatty substances, known as plaque, in the coronary arteries. Over time, the walls of your arteries can become filled up with fatty deposits. A diagnostic procedure known as coronary angiography is used to image these arteries, by injecting contrast into it and projecting this on a series of X-rays to outline the inner vessel wall and show flow through the lumen. An angioplasty procedure, a therapeutic step, used to help relieve symptoms of CAD. This is where a guide wire is passed into the coronary artery, that has become narrowed by a buildup of plaque. A tiny coronary balloon is inserted along the wire and then inflated to squash the plaque to the sides and improve the flow of blood through the section of the narrowed artery. This is often followed by the insertion of a metal mesh, called a stent, which holds the artery open after the balloon is withdrawn. If the plaque is soft enough, it can be easily treated by standard angioplasty. But when the plaque is too hard to be pushed aside by angioplasty, the drill comes into play. The buildup for prolonged period of time can cause the plaque to become extremely rigid and hard, called as calcium. To work out this problem, medical researchers created a small device known as rotablator, and the procedure is known as rotational atherectomy or rotablation. One of its end presents a bar coated in diamond dust, and for this reason, it is also known as diamond rotor. The bar, mounted on the tip of shaft, has a nickel-plated elliptical shaped structure coated with microscopic diamond crystals that is about 5-micron diamond, able to ablate the hardest fibrocalcific plaque and rotates at up to 190,000 rpm. The diamond-tipped bar is engineered to immediately engage the calcified area, enabling precise control of ablation even in tight or occluded areas. The bar spins concentrically on the wire, providing confidence even when treating small or tortuous blood vessels. The basic physical principle is differential cutting. It allows the advancing bar to selectively cut inelastic material while elastic tissue deflects away from the bar. The 95% of the particles generated by the rotablator are less than 5 microns and they are removed by the body's bloodstream. There are different sizes of bar available for coronary rotational atherectomy. The smallest bar is 1.25 mm and the largest is 2.5 mm. The size of the bar is selected depending on the size of the artery and calcium load. The rotablator is powered by compressed air or by nitrogen gas for its bar rotations. This drill is used to chip away at the plaque to gradually widen the narrowing. Once this has been done, a balloon can be inserted and the angioplasty can proceed as normal with balloon and stent. The primary purpose for the development of the rotablator was to tackle the rock-hard, calcified lesions that standard angioplasty balloons have failed to treat effectively. Finally, this ensures satisfactory treatment results over the long term. The invention of the system surely relieves the patients from calcified coronary diseases and supports the treating cardiologist from a difficult angioplasty procedure. I think you have gained the most valuable information about the treatment of coronary disease and one of its modern technologies. If you have enjoyed the video, please subscribe to our channel, like, and share it with your friends and families. Thanks for watching. Stay curious for more videos like this.